Hi, I'm Simon Wade. I'm a student of physical therapy. Matt, do I have your permission to touch and locate some structures on you and take a video of it?
Yep.
Perfect, thank you. So we're gonna palpate some structures on his elbow and forearm. I'm gonna start with his palm turned up. If I have you press up into my hand, Matt, I can feel his biceps muscle tighten, and if I follow that distally, I can actually find his biceps tendon here. That's gonna be important because we use that to help identify the brachial artery. From here, Matt, don't let me turn your wrist over, or you try to turn your wrist over and I'm gonna turn it back, I should say. So try to turn your hand over, right? Good. So I can feel his pronater teres running obliquely here, and that's tight, turning his hand over. Don't let me pull your wrist back, Matt. Good. I'm flexing his wrist and I can feel his common flexors here running from his medial condyle. And these are all tight. I can strum across those. Relax, that's good. If I move distally, I can differentiate some of the tendons from those there. So if you bring the pinky and the thumb together, I can actually already see his palmaris longus popping out at me. And that's gonna be the only tendon that doesn't go through the carpal tunnel. If I bring his wrist into some flexion and I radially deviate, don't let me pull, Matt, I can feel the flexor carpi radialis here popping into my fingers. Relax. Now I'm gonna ulnarly deviate a little bit. Don't let me pull. Good. I can now feel out here a little bit more medially the tendon of the flexor carpi ulnaris tight. And if we rotate his hand over a little bit, keeping his thumb up so we're in neutral here, if I find his lateral condyle of his humerus and I move proximal, I can find the origin for his brachioradialis. Matt, try to flex like you're doing a hammer curl for me. Thumb up towards the ceiling. Good. And that's going to tighten that entire body of the brachioradialis here. If I move just dorsal to the brachioradialis, Matt, I'm going to have you try to bend your wrist back for me, okay? I can find his extensor, carpi, radialis, longus, and brevis popping together there. And his brachioradialis should not be tight, which is not, so that's how I know I'm on the right muscles here. You can relax for me now. Now try to straighten those fingers out for me, but keeping your wrist relaxed. Good, I can feel his extensor digitorum here, just kind of ulnarly to that last one, kind of dorsal here. That one's tightening. And then if I have you bend your wrist back and try to bring your pinky this way. Now good, now don't let me pull your hand away from you, okay? Good, now I can feel his extensor carpi ulnaris on the bottom here, tight too. And that concludes.